Hi, I'm Tracy, I'm a recovery nurse and I've worked here since 2009. So I wanted to do nursing since I was the age of 5. I had planned on going into nursing when I finished school. Due to medical condition and the amount of hard work and manual handling we had to do, my consultant said that it probably wouldn't fit me working in recovery. So I wasn't happy about that. So I went to join the army, 19, went through all my medical qualifications and etc. and they were happy to accept me, and then I found out I was pregnant. I started my career in 2000. Before that I was a mum, housewife, but I did work part-time in various different shop locations and hotels, etc. So on an average day I'd say between 60 and 80 patients that would go through each recovery area as a whole. Our obstacles are making sure we've got a bed, so that's why we need bed managers, and we go to meetings to see what beds are available and what aren't. If beds aren't available and they're day cases, we do actually discharge patients from recovery as well. So we have an agreement with the surgical day unit for locals up till midday. We can take the patients from theatres and we would discharge them from recovery, and this enables them to be able to receive more patients in to then have a good follow through to theatres, because as soon as we stop and we can't admit any more, then obviously the flow from theatres can't discharge. As a manager, you need to manage the area and look ahead of time. So what can we do to try and make sure that that pathway is an easier pathway for patients to, and also making sure patients that are happy when they're in recovery. Recovery, on a general day, come in at 8 o'clock in the morning, have a team brief, decide what patients are coming through from theatres into recovery, looking at staffing, making sure that we've got adequately trained staff for the area working on the day, looking at the list, what beds we need, what high care patients are coming through, and just generally support the team while we're at work. Basically look at sickness, look at HR, recruitment, return from work appraisals, and then the general running of the room. So if we're really busy, then I'm clinical. If we're not so busy, then I will work in looking at people's progression, development, and where I can support them. I think knowing that when I've worked a good shift, everyone's been able to have their procedure done, everyone's got a bed to go to a ward, and there's not a lot of delays in recovery, which happens quite a lot because there are no bed spaces. The staff are happy. It's just making sure that the care is provided that we need to give. This hospital is one of the leading teaching hospitals, and we have a fantastic education team to provide the good support for new starters and staff that work within the UHS to develop their skills, to help them progress in their career. We also have a lot of specialities that work within the trust. It's just so nice to work across all different specialities. I just really enjoy theatres, recovery speciality really, and it's just knowing that the patients that come through and you look after, you've made a difference to their lives. Within recovery, we have a very good training programme. So you start with a booklet of all your competencies. We give you, on average, around about 2 to 3 months where you're supported learning, so you're not counted in with the numbers and you're not expected to work alone initially. And then we build up your portfolio, making sure that you're competent to work in all specialities, in all areas, and then with the support of a mentor and a student as well, and the education team. And then they sort of help with your development, your learning needs, as well as the staff that aren't your mentor and buddies also help and support. And there's always regular meetings within your time that you're supernumerary or supported learning, that you can seek advice, support if necessary.